Hey everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. In today's video, we're going to be discussing a medication known as Terbinafine. Its brand name is Lamisil. Now before we talk about the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. Now during this presentation, we'll discuss the mechanism of action or how this medication works, indications or reasons we would prescribe this medication to a patient, followed by contraindications or reasons we would not be able to prescribe Terbinafine. We'll then touch on examples of dosing, and then finish it off with side effects with percentages. I've put together some slides to go over this information, so let's jump right into it. So the first thing to discuss here would be the mechanism of action or how this medication works. So first of all, terbinafine hydrochloride is a synthetic allylamine derivative. It inhibits the biosynthesis of ergosterol, which is a crucial component of fungal cell membranes. In terms of indications or reasons we might prescribe this medication to a patient, it may be used in the treatment of dermomycosis, which is a disease caused by infection of fungus such as ringworm or thrush. Onychomycosis, which is a fungal infection of the nail, is another reason somebody might be prescribed this medication. That's typically the toenail. It can be the fingernail as well, but typically the toe. As well, tinea capitis, which is a fungal infection of the scalp involving both the hair and the skin, would be another reason that this medication may be prescribed. With respect to contraindications or reasons we would not be able to prescribe terbinafine, well, we wouldn't give this medication to a patient who had a hypersensitivity to terbinafine or to any other component of the product. Also, when it's taken orally, we wouldn't give it to a patient who had acute or chronic liver disease. Now for dosing with terbinafine, so in the treatment of dermomycosis, if a patient was using the 1% gel, they would apply topically once daily for about 7 days. If they were using the 1% cream, they may apply topically twice daily for 1 week, or 2 weeks if it's a plantar fungal infection. For tinea capitis, we may use the oral formulation, giving 250 milligrams orally daily for 6 weeks. This would be an off-label dosage. As with all medications, there are some side effects or adverse reactions that patients may experience while using terbinafine, so we'll go over some of those here now. 5.5% of patients may experience a rash, while again 5.5% of patients may experience diarrhea. A disorder of taste may happen 3% of the time, and indigestion may happen 4% of the time. 2.5% of patients may experience nausea, and 5% may experience vomiting. 3.5% may experience increased liver enzymes, and 13% may experience a headache. A fever can happen 7% of the time, and a cough can happen 6% of the time. Alright everybody, that's all we're going to talk about today with terbinafine or Lamisil. As always, I'm very thankful you took the time to come by and watch one of my videos. If you found the information valuable and you'd like to help grow this channel, remember you can like the videos, share the videos, and most importantly subscribe to the YouTube channel. And there's also some links in the description you can check out as well. So for today, take care.